Good evening to everyone present here. Today with us we have Dr. Nishita Bhosle and Dr. Kinjal Shah, who are the speakers of today's session on dentistry. So Dr. Nishita Bhosle is an MDS periodontist and an implantologist and an assistant professor in the Bharati Vidyapeeth Dental College and Hospital, Pune. She's a certified AHA, BLS and an ACLS instructor, and has many national and international publications by her name, and also a book publication named Freedom, Attachment and Applied Respect. She's won various awards at conferences for paper and poster presentations. She is from the first batch of students who passed out from GEAAA in the year 2008. And Dr. Kinjal Shah is an intern at Naya Hospital and Dental College and also a gold medalist. And she passed out from GEAAA in the year 2014. So we're really happy
Thank you.
to have you here. So
Thank you so much.
would you like to add anything about yourselves?
You've said it all.
Yeah, I'll start. Is the screen visible?
Not yet.
Not yet.
Is it visible now?
Yes.
Yes,
Yes.
we can see it.
Okay. So, what is dentistry? So I would like you guys to elaborate a little more on this field and its scope in future.
Okay. So shall I begin or?
Yeah, sure.
So before going on to dentistry, I would like to focus on what are the points that we should consider while choosing a career. So for me, there were two major points before I choose dentistry as my career. The first point is that the career which you should choose should be enjoyable. You should have the most important thing is that you should have a passion towards that career. If you don't enjoy, if you don't have a passion for that career, then it's of no use. The second
Yes.
most important thing is that you should use your natural strength and ability. So the career which you choose or the path which you choose you should be able to choose all your abilities and all your strengths. So taking these 2 points into consideration, that's why I chose dentistry. So coming on to dentistry, so as the slide shows, the dentistry is a combination of a doctor, an engineer, and an artist. So it's a combination of all three areas which combines to form a dentist. So it's a very beautiful course. It helps you interact with a lot of patients. You bring beautiful smile, aesthetic smiles. You create aesthetic smiles for them. And the beauty of dentistry is that apart from teeth, apart from your oral cavity, it helps you to diagnose a systemic disease. If the patient has any other systemic disease, in the sense, if he's suffering from any, say, blood pressure or diabetes, and if it goes unnoticed, you being a dentist can diagnose that also. So it's not only related to the teeth, it is related to your entire body. So that's what dentistry is.
So I would also like to add that in dentistry, it's basically that there is a big misconception that it's just about teeth, but it's not that. It's about teeth. It's about the joint which is present here, which helps in chewing and the opening and closing of mouth. It's about the muscles, about the blood vessels. It's really about the entire face and neck. So it's not just about the teeth that we see. Like when I chose my career, actually, to be very honest, when I got dentistry, I was very sad. I was not that happy because for me it was like क्या करना है अब बस मुंह में देखना है मुझे और क्या करना है. So I had this big misconception because nobody was in my family a dentist or I didn't have any dentist contacts. actually to tell me that is, it's not just about teeth. But now that when I have completed when I'm going to complete my graduation, I have learned in these 5 years that it is so much more. It is like we say that the dental pain is the most horrifying pain on earth, that we can say. तुमको सोने नहीं देगा ये. When you have pain in your teeth, it will not just let you sleep. So that is, I think that is so blissful when patients come to you and patients tell you, hi, can you hear me?
Yes, yes.
Yeah.
Yeah. So when patients come to you and they tell that ab chain ki neend se sone ko mil raha hai. So it's really something. It's not just that we are just treating teeth. It's about so much more. There is oral cancer, and there is many more things in dentistry that we can do. So a big misconception that first of all has to get clear that it is not just teeth.
True, true.
So, yeah. What is it like to be a dentist or a dental surgeon in India? And we'd like to know a little more about your personal experiences as a dentist. Dr. Nishita.
Yeah, so my experience, my journey of being a dentist till now is amazing. I have experienced, in fact, everything. Starting from the first year of BDS, my college was in Pune, so I had to stay away from home. The experience, starting from the experience of the hostel life, initially you feel that abhi independence mil gaya hai, freedom mil gaya hai, ghar se dur reh rahe hain. But then along you come to know that along with your freedom comes the responsibility, because you're going to become a doctor. You're going to treat patients, so you have to be more focused on what you're doing, and you should be goal oriented. You enjoy also at the same time, but then you are focusing more on improving your skill sets, so that when you do when you do a patient, that time there's no room for an error. So my journey, my experience, I've evolved over the years. I have improved my skill sets. I've done my master's, so I've become a gum surgeon. That is what a periodontist means. So my journey has been a very beautiful journey. I've learned a lot. And as a person also, I've evolved a lot. Yeah.
So basically my journey as a dentist, I am still an intern, so I don't have much experience like Dr. Nishita. But according to me, in my 5 years, I have learned so much that so once this happened that I did a cavity preparation in a patient. That is, I removed the cavity. I removed the the caries that was present in the patient's teeth, and I filled it. And that patient had a lot of pain in her tooth. So I did all that, and it happened so that she was a pani puri seller. And one day I went to that stall and I did not realize that she was the same patient. And she just like came to me, "Arey doctor sahab, aap hi to ho ye, aap hi ho." And it was so mesmerizing to get recognized like that. Like she was like, "Aapne bas kiya, uske baad bahut shanti ho rahi hai," and all that. And she actually offered me to give it for free. Like she's like, "Bas aapne jo kiya wo bahut ho gaya," karke. So it actually gave me respect. It gave me responsibility. It showed me that people remember you. This happened like at a span of 6 months. Still she remembered me that I was the one who did it. So it was really great. In that way, I feel like we actually changed patients' life. So the misconception is there that only MBBS things change and BDS does not, because what are we doing? We are not doing something great. But it's not that. We do affect people's life, and it shows. We can see that.
That's true.
Right. And I also wanted to ask you, like, what has been like the best experience you've had yet? Like something that made you learn a lot about dentistry and how people are like with dentists, and something that like gave you a really good lesson about your career and profession, something like, or some special case that holds like a really special place in your heart, like something that's very memorable.
So I had a patient who was, say, a 45-year-old female, and her entire gingiva. So gingiva is known as gums. The pink things which you can see, those are gums. So the entire gums was swollen. Her teeth were mobile, and all the teeth, almost all, generalized. And she was like literally into tears that I cannot smile properly because my teeth were protruding out. They were coming out because of the swelling. There was bleeding in the entire mouth. There was bad breath from her mouth. So that was one of the special case because we did a full mouth rehabilitation. That is, we got her entire gums into her healthy state. We gave her implants. We had to extract few of the teeth because that was not savable. So we gave implants. Implants are something, a screw-like device which you place in place of your missing teeth. When you extract a teeth, you place an implant. So after the before and after picture, the transformation of her smile and her confidence and everything was really beautiful. So she was literally in tears when her the entire treatment got completed, and like she was very, very, very happy with it. So that's one special case. There are many, but this is one of the very dear case to me.
And Dr.
So yeah, so for me, it was this one time that I am still an intern. So while practicing, my senior doctor, me and my senior doctor, we were there, and there was a case where there was a patient who was like 22 years old, I think, and he had a habit of areca nut chewing. Like it's a kind of nut which kinds of fibroses the muscles of chewing, which help in opening and closing of your mouth. So basically, in simple terms, it hardens those muscles. It does not work as easily as it should. So what was happening is that he could not open his mouth even a little bit. Like just to eat roti and chapati also he could not open. It was just like वो straw से बस drinks ले रहा था. So he and his mom had come, and his mom was crying like बच्चा इतना छोटा है, सिर्फ 22 साल का है, ये क्या हो गया है, everything. Like she was in tears. Like I could not stand, and even I got a little bit emotional. I am like, please don't worry, everything will be fine. And and then my seniors and we decided an entire treatment plan, and we gave him medications, we gave him physiotherapy and everything. And slowly over time, his mouth started opening. He became better. We also gave him counseling for elimination of the habit, and he kind of became a better person. It was not just about treating his oral cavity and treating his disorder, but about treating his entire lifestyle, what he was happy, what his habits were. And his relationship with his mom also improved because he became more open about how his company was, how his friends were, and everything. So that was a really special case where his mom then came to me and said that आपने promise किया था, and आपने किया भी वो करके. So it was really nice. That one thing was very nice.
Exactly, great. So we'll move forward. Yeah. So educational qualifications required to become a dentist in India, like what does the total course comprise of, and what are the stages that you need, like educationally, to become a dentist in India? So, yeah, Dr. Nishita.
Yeah, so to go into the BDS course, you have to pass your 11th and 12th standard. With the PCB subjects, you should have physics, chemistry, and biology. Once you clear the 12th standard examination, then you have something known as NEET entrance, which one has to appear, and you have to get certain amount of marks to get into good colleges. And once you enter the BDS course, the course is of 5 years, 4 years plus 1 year internship. That is a total 5-year course. And after, once you finish your bachelor's degree, you can move ahead with your master's degree, that is the master's in dental surgery, which is of 3 years.
Right. So the cutoff for NEET actually changes every year. It's variable, but generally we need like 550 to 600, I think, to get into a good.
Yes, government college, right?
Yeah.
Government college, yeah.
Yeah. So we did receive a question, which was, what is the main difference between doing the BDS from a private or a government college? So like,
I feel it is basically, it doesn't matter in the end of once you get graduated, once you start your clinical picture, it doesn't matter whether you've graduated from a private college or you've graduated from a government college. The only, irrespective of whichever college you're from, the only thing is that it depends upon you how you are improving your skill sets, how many patients you are doing. So always choose a college which has a very good patient flow.
Good patient intake, yeah.
So second thing, it should have the latest equipments or facilities available. So these are the two more important things which a college should have. If you don't have these two things, there's no use of your degree. Later on, after you complete your BDs, you will have to do short courses and do a root fellow, certificate courses and so on. So you're wasting your money in that.
So sometimes people prefer government colleges because generally it is obvious that government colleges give treatment at a very less price, at very less cost. So there are a lot of patients which come. Now, I myself am an intern in Nair Hospital. So every day, even in COVID times, there were at least 60 to 100 patients coming in each department with some or the other complaint. So it is like there is never a shortage of patients. So you get to practice so much and you get to see so much, so many cases that after passing or graduating from this government college, that you literally have no case that you feel like ye to kabhi dekha hi nahi, what is this karke. So that is my lookout for government colleges, that generally all colleges have that, but government definitely have a big patient intake. So that helps you a lot in your after graduating, when you open your own clinic, when you're on your own, when you don't have anyone to guide you. So that's it.
Okay.
So don't worry if you also don't get into a government college. Government first preference is always government. If you don't get government, check the deemed universities or private universities which have a good patient flow. So if that college does have a good patient flow and good facilities, then you can surely opt for that.
Yeah, absolutely.
We received a question that BDS from a private college, is it a good investment in the long run? Shloka has asked.
Yes, it is. The fees are a little higher in private, but definitely it is. Again, same points.
Yes, that the patient intake has to be good.
Yes.
The patient intake has to be good. Do some research yourself for which college that you are opting for, and you ask the cast out students from those colleges. You research yourself a little bit if the patient intake is good, because dentistry is basically a skill focused field. It's 90% skill focused, and it's obviously knowledge based also, but if skills are not there, then there is no use of being a dentist. And you can practice and sharpen your skills only if you get patients to practice on. Otherwise, there is no use of only reading that what we need to do.
Theoretical is something different, and practically it is way
entirely different. Yes, entirely different.
Yes.
So we move forward. Any questions? Okay. Yeah. So the entrance exam for BDS, that is the NEET, which is also known as one of the most difficult exams in India. And so
NEET basically I was the lucky batch. You can say that I was the last batch that didn't have to give NEET. After my batch, the NEET started. So NEET is an entrance exam for, I think, all the courses. It's a common entrance exam, and it is basically divided into two sections. You have section A and section B. Section A, you have 200 questions, out of which you have to attempt 180 questions. There are two sections, section A and section B. In section A, you have 35 questions. You have to attempt all of them. In section B, you have 15 questions and you have to attempt any 10. So this is for physics, chemistry, botany, and zoology. So these are the 4 papers, question papers for the NEET exams. And for every correct answer, you get 4 marks. For every wrong answer, you get a negative marking. But you've not attempted any question, you won't get any marks for that. So this is overview of a NEET exam entrance.
So the top colleges in India that offer BDS. So here's the list. Dr. Kinjal, would you like to elaborate a little more on it?
Sanchi got logged out, it seems. She's
Yeah, I
back.
guess.
Yeah. Sanchi, don't be so stressed.
Should we answer that?
Yeah, you can continue talking about the slide though. She'll put it back on.
I'm sorry, yeah, there's some network issues.
Dr. Nishita, do you have something to say on this slide?
No, top colleges,
Yeah, I
the
guess
list
so.
varies every year, so it doesn't make a difference.
Yeah.
Government is first, and then your private colleges, any one you choose, depending
Yeah.
upon the patient.
Yeah, so
Also, do opt for going to the south. South colleges are also really good. There's a language barrier, but then they have good patient flow, such as Savita Dental College. It's the most famous college in the south, and I think it has won an award, national award or something, internationally best college or something like that. It is a very, it has good facilities, good patient flow, and it is the facilities which they provide is at par to that of your colleges in abroad. So if you're willing to go to south, Savita Dental College is one of the best colleges.
Right.
Yeah.
Yeah, so what can be expected in each year of dentistry? We did receive a lot of questions for this part. You know what all is actually there in dentistry and what are you studying in the course of 4 years? So
yes. So basically, in the first 3 years, I think, or the first 2 years, I can say that a lot of subjects match with MBBS. So the syllabus is kind of little less, but the subjects are the same. So in first year, we have our anatomy. So in anatomy, we also experience dissection. We do dissection of the head, neck, and face. We don't go till the limbs and the abdomen because that's not in our purview. But we do have dissection. We study the entire brain, the skull, and everything related to it. Then we also have biochemistry and physiology. So there are 3 subjects in first year. There is anatomy, biochemistry, and there is physiology. And in the practical based of first year, there is dissections. Then there is embryology, where you study about the embryo. So the main thing that again I'm stressing on, that it is not like that you take dentistry and you do not learn about the entire body. You have to learn about the entire body, whether you be a dentist or you be a general physician. You have to learn. So there are these, then there are blood tests that are done. We learn those tests, how to count the WBCs, how to count blood platelets and whole blood count, everything. Then there are various urine tests also that we do. So we get a basic knowledge of everything. So that is that in first year. Then comes the second year. In second year, we go a little bit more into dentistry. In first year, it was a common thing. In first year also, we learn, we do carvings. So carvings is a compulsory thing where there are wax blocks that are given to
anatomy and dental histology.
Yeah, anatomy and dental histology. So there are these this that is given to every student, and we have to carve the tooth. So by doing that, we learn the exact anatomy, the exact shape and morphology of the tooth. So that is a compulsory thing. Wax blocks are given, and we use a carver to carve the entire tooth, like literally sculpting it. That is the one main reason why we are an artist also. That's in first year. Then in second year, we have microbiology, we have pathology, pharmacology, and we have dental materials. So, Dr. Nishita, would you like to say?
So second year, you have pharmacology, what else did you say? Dental materials, microbiology. Pharmacology is very important because you're going to prescribe drugs. So what drugs, what are the pharmacokinetics, or how does it react in your body? When does it excrete from your body? So in-depth knowledge about all the drugs which we prescribe to the patients, you get an in-depth knowledge of the same. Microbiology and pathology is again an MBBS subject. So a little bit about medical terms you learn in that. And dental
And also
material.
there is this tissue, various tissues that are given, and we see it under the slides to identify which kind of
Yes.
disorder in pathology. So it really gives a feel of, having a general knowledge about everything. So when you go out in the open world and when you start practicing, it's never like that you are a dentist, you won't know about this stuff. We always have a general knowledge, and we will be able to guide each and every patient who, if they have any doubt regarding anything else except the oral cavity. So it's that. Then there are always, then in practical ways, we prepare various drugs also in pharmacology. Then we prepare toothpaste, we prepare gum powders. Then there are, what else is there? We also start with pre-clinics, I think, in second year. Yes, we start with pre-clinics. Yeah. So in second year, yes. So there is cavity preparations, which we do on a phantom model. So how to learn how to retract the cheek, how to protect the tongue and the oral mucosa while you work on the teeth. All of that is also taught in second year. So in second year, in short, there is microbiology, pathology, pharmacology, and there is dental materials. In dental materials, we learn about the various materials that are used in dentistry, their properties, how to manipulate them, how to mix them, how to apply them, everything related to each and every material that is used in dentistry. So that is in second year. Then in third year starts the main thing where you actually work on patients. Now you get the permission to learn and to work on patients in real. Actually, you do it, and that gives you a lot of confidence that you will definitely feel nervous, because this is something that is irreversible. Once you start cutting, you cut it. There is nothing you can do. So, but it does give you a lot of confidence. So in third year, there is general medicine, there is general surgery, and there is oral pathology. So in general medicine and in general surgery, we see various cases. We go into wards, we have our wards, and we see various cases of almost all, diagnosis. Like there is hernia, there is breast cancer, there is ulcers, there are foot ulcers. There are many cases that you see. You learn to diagnose them, you learn their management. So you get a basic knowledge of everything. And the best thing in third year, you start working on patients. Each and every department, there are 8 departments in dentistry, there are 8 subspecialties, and you learn each and everything about them. And then in final year, there are those 8 main core dentistry subjects. There is nothing that matches with MBBS now. There are the main 8 core subjects, which in the next slides also, I think we can continue.
So these 8 subjects, or the 9 branches, or 8 branches in dentistry, which are introduced in the third years also. Yes. So in the third year, few of these subjects are introduced in the third year. So you get an idea of what exactly are these branches. So it becomes easier for you in the fourth year, final year, to study those. Correct. And your final year exams, now the pattern has changed. So the final is divided into 2 halves. You have the final first and the final second. So in the final first, you have 4 subjects, and in the final second, you have the rest 4 subjects, or the 4 branches.
In government branches, I don't think it still gets changed. Yeah. Okay. I don't think, but my friends currently are giving those exams, and still they are giving in the same pattern, that all 8 subjects are
all 8 subjects together. Okay.
Yeah. So it's really difficult.
Yeah. Eight at a go is pretty difficult.
There is too much to learn.
So we received a question, which is, what made you select this field?
Okay, so for me, I always wanted to do something in the field of medicine. That I was sure of. I wasn't sure if I wanted to go into MBBS or BDS or homeopath or what, but I was always sure that I wanted to be in medicine. Then secondly, which prompted me to choose dentistry was I am not a very studious student. To be honest, I do not like studying 24 hours. And my own sister, she is doing MBBS. She is right now an MD in medicine. And she told me that for doing MBBS, you need a fire. You need a passion. That subhe sham rat, you need to study when you need it. It is a lifestyle where it's not like aisa ki, you can enjoy also ekdam achhe se, and you can study also ekdam achhe se. It's like you need to have that kind of that kind of love for the subject. बट मेरा ऐसा नहीं था, मुझे पढ़ाई से इतना भी ज्यादा प्यार नहीं है. So I chose for dentistry because I love partying also and I love studying also, and also I love the flexibility that dentistry provides. Like in MBBS, it's not like मुझे रात के 2 बजे भी जाना पड़ेगा. I have my own work hours. I can work in those hours. I can earn money. I can come back home. I can enjoy my own life also. I'll get the respect of a doctor. There is everything in balance and it is settled in. So that was my first and only choice for dentistry.
Yeah, I agree with Dr. Kinjal. Even I wanted to go into the field of medicine, but then I wanted to become a dentist because since childhood I was very fascinated with all those equipments when I used to visit the dentist and all those machines and those drilling machines and all that. I was very fascinated with it. And also I did see how the dentist can change one's smile and bring one's confidence back. So, and I
Yes,
also I like interacting with people. So yeah, so that's why I chose the field,
true.
dentistry. Yeah.
In dentistry, it's like you make a friend for lifetime. Like you treat one patient and they tell 10 more ki please iske paas jana. Good. So it's really,
So we move forward.
thank you.
So the list of courses after BDS are these.
Yes, these are the various branches in which you can do masters. In all of these individually, like after doing your BDS or graduation, you can do your post graduation in any of these branches that are mentioned here. So in short, if I tell, I can explain a little bit about each branch. There is oral medicine and radiology, where you do the diagnosis and you do the radiology aspect of various diseases in the oral cavity. So there is various white lesions, there are cancerous lesions, there are many things. Like I won't bore you right now, but there are a lot of diseases in which oral medicine and radiology is the most important, where you get to diagnose those cases so that further you can know what treatment you can plan. Then there is periodontology that obviously, Dr. Nishita, you explain, you are the expert in this.
So periodontology is something, it's a branch which deals with your gum and gum disease. So it's basically a surgical branch where you treat the gums and the defects or the bone, the underlying bone, that which is known as the alveolar bone, the defects in that. So you use bone grafts, that is, you use an artificial bone powder in that, and you regenerate tissues in this.
Yeah,
Also, you can replace the missing teeth with the help of an implant, which is also it's type of a screw, which is an upcoming area.
right.
Oral and
So in oral and maxillofacial surgery, so this field is really amazing. This branch is really amazing. Here you get to treat various accident cases. You get to treat fracture cases, trauma cases. So in my department in Nair, I have seen there is an emergency department that is open 24 hours. And one night there was a patient who came who had a bike accident, and he had his entire mandible that was separated. So it was moving entirely. So it was a really, the panic was present in the department, but it was excitement to see such a case, to help such a case. And so this field basically deals in extractions, it deals in removal of the teeth, obviously, and it deals in various surgical part also. So there are flap surgeries, there are these traumatic surgeries, there are surgeries which help in, pushing the jaw backwards or, taking it ahead. So it is entirely a surgical field. So if somebody feels like BDS mein mujhe sirf daant nahi chahiye, I want to be more of that kind of person who needs the thrill. So you can always opt for masters in this branch. You get that in oral and maxillofacial surgery.
people who opt for oral surgery can can treat patients who have cancers.
Yes.
So cancer of the jaw or the tongue or the head neck region.
Yes. So you get a lot of exposure in that field.
Yeah.
Then there is endodontics and conservative dentistry. This basically deals at the root canal treatments. It deals in bleaching, in cavity preparations, in composite restorations. That means tooth colored restorations. So basically it deals with everything which helps in preserving the tooth. We need to protect the tooth in the oral cavity. So this branch deals in all concepts regarding that. So Dr. Nishita, please continue.
Prosthodontics and crown and bridge is something where people who don't have teeth, all their teeth have lost. So then there's something known as denture, which is in the layman term, it is known as scurvy. So that prostho people take care of. Also, after root canal, you need a crown or you need a cap. So that also a prosthodontics take cares of. Also, if you want to build up an aesthetic smile, so you have veneers and laminates and so on. So this is all.
There are also these obturators which we make. It is like in current cases, there are a lot of cases which are coming because of COVID, which have all these entire maxilla with the eye region and all of that is entirely affected. So all of that is now then surgically removed, and then artificial obturator is placed in the area. So the construction of that entire obturator is also in the hand of a dentist. So there is a lot of things that are there in this branch also. Then there is that is pediatric dentistry. So this deals with everything entirely in a child in less than 12 to 13 years of age. Everything, each and every branch that is mentioned here, everything is done in periodontology in a child. It only deals with children, everything specific to those. Now, why is that a different special branch? Because as you know, the human teeth erupt in two stages. First, the milk teeth come, they exfoliate, and then the adult teeth come. So the entire process of that when those teeth come, the spacing that is present between the teeth, if the teeth is not present, what to do? So there was one case where generally the tooth erupt between 7 to 8 months. The first tooth erupts between that age. And there was a child jiska around 1.5 years ho gaya tha, and still none of the teeth had been erupted. So like these cases, this department then handles that. What is the cause behind it? What treatment can be done? All of that, depending in children, everything is handled by this department. That is pediatric dentistry.
Orthodontics is a branch which deals with your braces. Though the wires, if you have crooked teeth or malaligned teeth, so to make them straight and to give a very pleasing look, you have braces which deals with orthodontics. Yeah. Also, now you must have heard in ads and all that you have that aligners, clear aligners, invisible braces. You must have heard. So this is all
Invisalign. Yeah.
Then
there is public health. Yeah.
Go ahead.
Okay. So then there is public health dentistry. In this, basically, it's community dentistry where in graduation we get posted in various areas like in KEM hospital or in Dharavi. And we go there, we help with awareness, we help in tobacco habit counseling, where we help the patients in eliminating the habit. And we also do various on-field treatment. Like we go inside their area, we go inside the Dharavi sector, and there itself we do the basic treatment which we can do, the preventive measures also which we can do. So all of that is then covered in public health dentistry.
Public health dentistry also includes the mobile dental van. So in our college, we have a mobile dental van where we go to the rural areas and we give, like what she said, preventive treatment or the on-spot treatment we give. So that is public health dentistry. And also it's more research oriented, survey oriented. Yeah. Then oral pathology.
Please continue.
Oral path is all what a microbiologist or a pathologist do in the medical field. So they will give you specimens, biopsy specimens. They come and they give you the diagnosis and all that. What kind of a biopsy is it of? Is it of a cancerous lesion or is it because of some trauma or something like that? So oral path deals with that.
Yes. So it's basically the diagnosis of each disorder giving by using the microscope, by a tissue sample. Yeah.
So apart from post-graduations, if you're not interested in post-graduations, there are some other options such as you can do fellowship courses or diploma courses in various fields. So you can do it in aesthetic dentistry where they teach you about smile designing, about veneers, laminates, and so on. You can also do diploma or fellowship courses in implants. So these courses are of 6 months to 1 year or 2 years. And these are offered by various universities in India as well as in abroad. You can do fellowship courses from various universities like Buffalo University in US. So you can get dental implant courses done there. You want to add something?
No, right.
So then you have something known as certificate courses. So certificate courses are short courses. So suppose you want, after BDS, you want to learn more about advancement in root canal. So if you want to know about rotary, then there are certain short courses of 2 to 3 days, which are taken by an MDS or a postgraduate So these are like, they teach you theory, and then there are hands-on courses. So they will give you a model or a phantom head to have a feel of what a rotary instrument looks like. Or even you have short certificate courses on laser. So they give you a jaw, a sheep jaw, or a chicken piece, a breast piece of a chicken they give you, and you can have a feel of how a laser works on that tissue. So those are short certificate courses.
Right.
So we had received a question that after BDS, which are the exams you need to appear for so that you can do your further courses?
So after BDS is, again, you have for post-graduation courses, if you want to do, you have to appear for NEET. That is common everywhere. Second, if you don't want to do BDS in India, if you want to go abroad. So every country has their specific entrance exams. If you go to Canada, they have their own. So our degree is not licensed abroad. So to work abroad, you have to give their licensed degree exam. And you have to clear the theory as well as the practical, and then you get the license and you can start working there. If you want to go to US, there's something known as NBD, NBD 1 and NBD 2. So for this, so you have to be clear. You have to be clear in your mind when you are in your undergraduate, whether you want to practice in India or whether you want to go to abroad. So if you want to go abroad, then from the third year of BDS, you have to start preparing for your NBD 1 and NBD 2. So also you have to get good marks in all 4 years. Second thing is that you should have one of the publications ready by the final year. Publication is what you should publish an article. You should write an article which gets published in a journal about any topic. Then the third thing is that you should have an experience, that you should do some social service. You can join an NGO. So that will also add up to your biodata. Yeah, resume. So yeah, this is for US. And there are other courses also. If you don't want to do post-graduation abroad.
In US, it's like that. No, I think we need to do the DDS thing also. It's the 3-year course.
But then for that, you can do DDS also. But then before doing DDS, you have to clear their entrance, NBD 1, NBD 2.
Even after clearing
admission for DDS.
So even after clearing both the exams, we are not allowed to practice there with our degree. To do their 3-year course of DDS. Yes. So our 5-year course is not considered there in abroad. We have to do their 3-year course, and then only we can practice in that country. Yes. Yeah. Only in Canada, I think it is like Canada, that we can only give the exam.
Yes.
In Canada, our course is eligible. So our 5-year course, you give the Canada entrance exam, you pass that, and you can directly practice there. You don't need to do their graduation course again.
Yeah.
Tanishka had asked a question. What is the procedure or courses that we have to opt for if we want to pursue dentistry abroad? So I hope your question is answered now, Tanishka. And the next question we received was, is practicing in foreign countries more profitable than practicing in India?
Can you repeat the question?
Is practicing in foreign countries more profitable than India?
I don't think so. It's the same. It actually depends upon yourself, how your skills are, and how easily you convince patients. In India also, you can earn the same as a dentist earns abroad. So it entirely depends upon yourself, how you convert the patients, how your skills are. You have to get updated with the latest technologies. You cannot only depend, acha theek hai, college mein yahi sikhaya hai, itna hi hai. The old technologies you cannot use. You have to update yourself. For that, you have to go abroad and learn their technologies and come here and practice in India. So it is the same. It doesn't have any major difference. It depends entirely on yourself.
I feel like practicing in India should be a thing, because here in India, I feel like when I have worked in this government college, I feel like there is no awareness. Patients do not know anything about protecting their teeth, preventing any kind of disorder. So being a dentist, I feel like if we have used the resources of this country so much, we feel like we should give this country back. So we can help the patients, we can help the people of this country, we can make them aware, we can tell them why teeth are so important. The teeth comes once in your life. Once they are gone, they are gone. You need to use artificial, you need to use other treatment procedures. You cannot do anything else to protect it. So the lack of awareness is so much in our country that I cannot even begin to start. I cannot even begin to explain.
Yeah, that's true. Also, the plus point in abroad is that they have something known as dental insurance.
Yeah.
So even
Right.
if we tell the patient, ideally everyone should get their teeth checked every 6 months.
Yes.
So which they follow in abroad. So that's why the dental education and the awareness
Awareness is much more there.
Yeah, right.
Also, because in India, the dental treatment is expensive. Patients do not come unless they feel the need to it. Like unless they have a lot of pain, they won't come to you just for a checkup. But there they will because they have their insurance. So it's not much of a cost burden on them in abroad.
We received a question from Shloka. If someone is passionate about the subjects in medicine or dentistry, but is not willing to practice, so should he or she pursue this field, or is it a good choice?
Yeah, you can. There are branches which are non-clinical branches in dentistry. If you are interested in more research, there's something known as Masters in Public Health, which you can go do it abroad. There is something known as you can do Masters in Hospital Management or Hospital Administration. You can do that. There's a branch you can do in OMR. You can do oral radiology or oral medicine, oral pathology. There's something known as forensic odontology. So forensic odontology also you can go do it abroad, or India also offers good courses in there. So forensic odontology is basically identifying a missing person with the help of your dentition, with the help of your teeth. So it also has a good scope. There are various non-clinical branches which you can opt for. Nothing like that.
Forensic odontology is, we had a course in our college about forensic odontology. So it is basically about how just by the teeth, the teeth ages and it shows a specific mark, and each teeth is like a fingerprint. It is specific to a person, it is specific to an individual. So using the teeth, using the, the marks that the teeth leave on the patient's skin or on the victim's skin, you can actually identify who the person was. So it's a really interesting field that way. So if you have an interest in that line, then you can pursue, as Dr. Nishita said, you can pursue that also. That is also very interesting.
True. And Stuti had asked us the question, what are the various non-clinical career options after dentistry?
So these are the non-clinical career options. Yeah.
And
the same that she explained before, yeah.
Akanksha has asked, why and how is CV building important and necessary for every profession?
So CV she asked, right? Karum.
Yeah.
CV, right?
CV
Resume.
CV, yes. Yeah.
It is important in every career because if you want to get a job as into academics, so your CV should be strong. So if you want to get a job in any colleges or any clinics, if you want to work as an assistant doctor, an associate doctor, they first see how much is your experience or how good or how nice is your CV. So that's why I think CV is very important. You have to get yourself updated, you have to improve your skill sets, and you should have a good experience and also publications if you want to get into academics.
Okay.
Also in abroad, they see most of that only. They see your knowledge less and they see what you have done extracurricularly more. They see your social services, they see your other, how basically you will benefit their country. That is what their lookout is for when they give admissions. So in that, your CV has to be, it just cannot have that you have been a kind of just a great at education and great in your graduation. You have to have much more things to write in your CV so that you have more chances of getting selected in your university.
Yes. Also,
Okay,
I wanted to
okay.
add about the courses that if you're interested in dentistry, also you want to do something related to medicine. So there's something known as a course which is offered by American Heart Association, which is known as the Basic Life Science course or an Advanced Cardiac Pulmonary course. So in that course, it helps us teaching. It teaches you how to, if a patient collapses in front of you and if the patient undergoes a cardiac arrest, so what are the next steps you should take to revive the patient. So this is also a very good course for, especially for dentists, because when we are operating or when we are treating a patient on dental chair, the patient can go under arrest. So you should know the basic life science behind it.
Yes,
And
the
also you
basic
can work
is
in
all
emergency
for all
ward.
disorders. Yes.
If you have a certified course or a degree course in this, and you also an instructor like I am, so I can go and work in an emergency ward of my hospital. So this is also a plus point.
Right.
That's really interesting. So Tanishka has asked a question. Please guide us on what things that we can add in our CV.
Okay. So in your CV, first is your graduation degree or post-graduation degree, whatever education you've acquired, you add that. Second is dentistry related, and based upon if I have to go into academics, then you should have good number of publications, book publications, paper publications. Then you should have what skill sets you have, what courses have you taken, have you done any fellowship course or have you gotten a diploma course. Then is your experience. So have you worked after an internship or after you finished with your during an internship or after your internship, did you gain, how much experience have you gained? Where did you work as an associate or assistant doctor? So after your education gets completed, every year or what, you have to do something or the other. You have to improve. You cannot say that 1 year I was just sitting at home, the second year after completing I'll do this course, I'll do that
Right.
course, like that. Every year you should be learning something, you should be improving your skill sets. So that is what will increase your CV. Also, extracurricular activity is very important. So if you are interested in some kind of sports, so you can go participate in say badminton. So there are various badminton tournaments which are conducted for the dentists, so for the medical. So I am a badminton player, so I have represented my colleges and at the university level, or I play for clubs also, so inter-club competition. So all that you adds weightage to your CV.
Right.
Right. So we'll move forward. Yeah, master's courses abroad. We also received a question regarding this about after BDS, master's in health administration from abroad. How promising is it? Because it's not very mainstream.
So if you are really interested into that administrative work, then this course is really good, because few of my batchmates have done this course from Australian University, Health University. So when you come back to India, you get a very good packages from the hospital, because the hospitals, they need someone a degree who has an hospital administrative degree, that also from an abroad. So they give you a good weightage for that, and the package is also very good for the hospital administration. If you want to
But
go
it
for
have that it does have that con in it that while you do that hospital administration, you entirely shift into your management stuff. You then do not do much about what you learned in your graduation, that is dentistry. So
yeah.
that focus is entirely shift. So it entirely burns down to what interests you. Does actually talking to people and helping them and treating them interests you, or does the management part interest you? Depending on that, both of them are amazing.
So would you like to elaborate a little more on the master's courses abroad? Am I audible enough?
Yeah.
Yes.
Dr. Nishita, would you like to?
No, I did not hear your question. I just got a call. I'm so sorry. Can you just
She
repeat
just
the
asked
question?
that would we like to elaborate on the master's courses on this slide?
Okay. No. So if you don't want to do post graduations and you want to do any master courses abroad, so you can always do it in public health. There is hospital management. There's something known as dental hygienist course, which is not much weightage is given in India, but it is a very, very good course in abroad. So in Canada, if you don't clear your entrance exam, so at side by side, you can do this course of dental hygienist. You can start working as a dental hygienist. You earn a lot there if you are a dental hygienist. And then side by side, you can again give the entrance and then you can start practicing a dentistry, or you can do DDS or any more fellowship courses there. So you have various master courses abroad if you're not interested in doing post graduations in India.
Right.
Do we have any more questions in it? No. So we should move on. Yeah. So this is my favorite part, the live cases and management of those.
So the first picture is me holding a 3 or 4 month old baby. So that baby, she had a cleft lip. So a cleft lip is basically when an embryo develops, the two parts of the lips, they join together. In a normal baby, they join together before the baby is born. But in this kind of cases, those lips do not join. So there is literally a cleft, there is an opening that is present, there is a division in between the two parts of the lip. So there can be a cleft lip and there can also be a cleft palate. So in this case, luckily, it was just a cleft lip and therefore the patient did not have any problem in feeding or in breastfeeding, because otherwise, if there was a cleft palate that would have been present, then the milk that she must be sucking from her mother's breast, all of that would she could not have been easily able to swallow it because there is an opening in the palate. All of that would have come out from the nose. So luckily, she did not have that. She had only come here for a checkup and for the dental, any kind of dental clearance, if the medical team wanted, before starting with the surgery to close the cleft lip. So she was really cute. So you get to see all these kind of patients also. From 45-day-old babies to elderly, old generation patients. You see everything.
Dr. Nishita, would you like to elaborate on the live cases part?
Yeah, so this is a photo of me standing outside my department. This is the place where I work. So in the upcoming slides, you can see my cases in a video.
Right.
I can elaborate there.
Yeah.
So this slide, it shows a step in denture fabrication. So basically, making a denture for an elderly person, it's not as easy as just arranging the teeth and placing it in the mouth. The teeth have to be of proper height. They have to be of proper width. They do not have to encroach into the cheek space. They do not have to encroach in the tongue space. Each and every unit of your mouth has to have proper space. Your muscles have to be relaxed. They cannot be stretched. They cannot be shortened. Your joint, your TM joint, the temporomandibular joint, that also has to be relaxed. That also cannot be in continuous strain. So in all of that, there are jaw relations that are taken. It is a various, the denture fabrication is like a 6-7 step procedure. All of this you learn, the preclinic you learn in the second year, and the clinical part you start in the third year. And then in final year, you do more advanced cases of the same thing. So that is just a step in denture fabrication that I thought of showing a picture so that people can get an idea of what practical work we do also.
Right.
And that again, the same thing that I explained, but this was a 45-day-old baby with a cleft palate. So the thing that you can see in her nose is a feeding tube. So because she could not drink milk from her mouth, there was a feeding tube that was inserted in her nose, from which directly food was given, drink was given to her. So she had come for a case for the management of the closure of the cleft palate. So in these cases, the surgical part, the bone grafting part, all of that is done at a specific age, where the baby is of specific weight, of specific age. All of that is decided, and then the surgery is planned out of how it should be done. Right. So these are some of the cases of the aesthetic treatment that we were telling about. You can see for yourself how much change it looks. So in real life also, there was this one patient who had an entire black composite, like you can see here, a black cavity that was present. And he told me that he was a football player, but he did not like to smile in any of his photos, even after winning the tournament, because it just looked very ugly. So there was this change that we did. These are tooth colored restorations, which are matched properly with the shade of his original teeth, and the smile line is changed. In both of the photos, you can see how much difference it creates. It gives you an entire new confidence that builds your life.
True, very true. Yeah. So the jobs after BDS or MDS, like, I think we're having some network issues.
No, Nishita, you're on mute.
Okay. Yeah, sorry. My bad. So jobs after BDS is there's something known as PA-ship. That is a clinical assistant program which the government dental college, that is GDC, offers you after internship. So you take for going ahead for CA-ship, there's an entrance exam which you have to clear. And as well as after that, once you clear the entrance exam, there's a interview. So once you clear that, you get an admission for CA-ship. They signed a bond with you of 1 year. They give you a very good package for the same, and you get to do a lot of cases in CA-ship. Then you can join the Army Dental Corps. There's you can join the Indian Navy, Air Force.
So in Army Dental Corps, it's like that you give the NEET exam, and they select from the top 500, they select around the top 100. And from that top 100, you have they take an interview and they take a medical exam, and you have to pass both of them. And from that, they select from the top, those 500, whoever passes, they select the top 100, and then they give the admission according to that. You have a 2 years short service commission, and then depending on what kind of service you give to our country, you can also extend your bond, and there are 10 years of 5 years, 10 years, and you can just continue with your job there in the government. So it's a very stable job. You get a good package, you get to serve, you get to treat, and you get to show your skills. It's Army Dental Corps is a really nice offer which you can take after doing your graduation. Our college also provides this similar to CA-ship. There is housemanship, which our college provides. It is kind of the same thing. So it's the same, where you get to kind of head or help in the department. Like there is KEM hospital. It is a major medical hospital. So there is a dental department in that hospital, where you can treat the dental cases. So you can get that also for 6 months, 6 months to 1 year. It is a course. So that also, it depends on how much marks you get in your final year. Only the top 7 or top 8 students, I think, get that housemanship.
Yes. Apart from the government jobs, you have various jobs at the private sector as well. So the hospitals, all big hospitals, they have a dental section where you can apply and where you can work there. Also, you can work in private clinics as an associate dentist or an assistant dentist.
Yeah.
I think it's lagging. 1 second. Okay. So busting common myths regarding dentistry. So I myself am a NEET aspirant, and I have heard a lot of these. And like many people have such common myths regarding BDS as a course, or how BDS is easier than MBBS. And so I would like you guys to clarify on these.
So I just want to tell you all, just imagine your mouth, which is also known as an oral cavity. It's such a small area. And in that small space where you don't have that much of visibility, you have to treat that patient. You have to give local anesthesia, that is injection, the numbing injection. So how difficult is a dentist job as compared to a medical practitioner?
Yes.
So you can never compare MBBS and dentistry. Both of the field, they are very good.
Have their
They are
own
very
specialities. Both are different. You cannot compare it that way, that one is easier, one is difficult. It is not that. Because even in dentistry, as Dr. Nishita said, it is such a small field. You literally cannot see. You need microscopes to see what you are doing inside that tooth.
Yes.
So doing that in all of that with the tongue moving around continuously, you need to protect the tongue, you need to protect the cheek. You cannot lacerate any of the mucosa, or there will be obviously excessive bleeding and pain. All of that doing in such a small area, it requires endless amount of skills. Not anybody without practice can do it. So BDS is easier than MBBS. That's not true. Both are equally tough, equally difficult. Both require equal hard work. It is not that it is something that MBBS nahi mila to aasani se chalo BDS karte. It's not that.
BDS, just imagine BDS mein you have to study the MBBS subjects also, plus you have to study your
Plus
BD
the
dental
dentistry.
subjects.
And
Plus
the biggest,
you have to learn a bit about engineering, about your braces,
Yes.
about the fillers,
Yes.
about what kind of wires you're going to use, about the dental materials and everything. Plus you have to learn carving and all that, where your artistry comes in place.
So
there are
it's
a lot
really,
of
yeah,
study in
all in one,
dentistry.
it's really more. There is so much more. And this is the best part, is it is entirely skill based. So there
Yeah.
is knowledge, but you need to have so much of skill to be an excellent dentist. So that is a really big thing. Then there is dentistry is just teeth. That is not true. We explained 100 times already. Dentistry is not just teeth.
Everything related to head and neck. That's why we learn head and neck in dentistry.
There is fracture treatments. There is, as I explained in those different branches, there is gum treatment. It is not teeth. There is bleeding problems. There are bad odor problems. And the best part is that almost all of the systemic disorders have their oral manifestations as the first symptom. So when a patient comes to you, you are actually the first doctor or the first person to tell them that you have that disease was, you need to get it checked. When that patient is so calmly sitting down, you get the opportunity to tell them that you can actually prevent that from happening. You can prevent it worsening because you get to see it the first.
So I would like to share my experience regarding this. So there was a patient who came on the OPD. That patient had full mouth abscess. Abscess is something, it's a cavity which is filled with pus. So that person had multiple abscesses in his oral cavity. And the gums was swollen. If you even touch it, it bleed profusely. So then this is a typical clinical feature, that the patient has an uncontrolled diabetes. So she didn't give me any history of diabetes, nothing. She had no medical history. So I could diagnose that she had an uncontrolled diabetes. So I went and told her to do her blood investigations, and yes, she had a very high sugar level. So dentistry, you have that opportunity. The beauty of dentistry is that you can help patient diagnose what is happening in the entire body. Also, there was one patient who had not given us a history of hepatitis. And there's a typical oral features which you see in hepatitis patients. So we were able to diagnose that the patient had a history of hepatitis, and then we send them for the further lab investigations.
So you actually help those patients in preventing the worsening of their cases, because we help them to know. We help them to know that they have a problem which they were unaware of. So med students do not have a social life. That is not true. We have a great social life.
The time management is very
important.
important.
It depends on how you manage your time. Time management is the most important thing. So you cannot just do that. Exam
goal oriented.
Yeah. So it just cannot happen that exam के 1 month पहले आप पढ़ने बैठे and then you are like नहीं अब तो मेरे पास enjoy करने का कोई time नहीं है. You cannot do that. You have to study the entire year. You have to gain knowledge as much as you can. You have to stand beside each and every teacher who is doing something, and you have to know what they are doing so that you get that knowledge. And at the end of your year, nothing builds up. Your main aim is that you do not need to build up your studies. You have to study as and when it is taught to you. You have to revise it, make notes, and at the end of it, you can easily just revise all those things and give your exam, pass, and have a great social life. It is not at all that med students do not have a social life.
This is the one sentence that I've been receiving a lot since I decided to get into the field of medicine. that you won't be
No,
having
please
a
do not
social
worry
life.
about that. Do not worry about that at all. We have a great social life, and that is one thing I selected dentistry because there is so much of flexibility. I can decide when I want to work on in my future. I can decide which time of clinics I want to, where I want to go at what time. All of that is depending on me, how much I want to put in into my career. So all of that is depending on you, and from that you get to have a great social life. All of that comes down to time management. If you don't do time management, you have no social life.
Right.
So then there is only intelligent students can become doctors. That is also not true. Not
Yeah, that's
intelligent students, hardworking students can become doctors.
hardworking
Anybody
students.
can become a doctor. It is not true that intelligent students can become. I was not so intelligent before. I am not yet so intelligent now also, but I am extremely hardworking. If I do not understand a topic, I read 10 books about it. I go online, I see videos, I talk to my seniors, I talk to my teachers. I get it cleared till I don't get the concept in my head. So you need to be hardworking. It is not that you are intelligent, you have a good grasp on things, you read it once and you learn it. Those people have their own luck. That is okay. But you have to be hardworking in your own way to gain anything. That is the entire moral. Anybody can become a doctor. All you need to do is work hard and have passion in it. You can become a doctor because bas mujhe naam ke aage doctor sunna hai. That is not one. That is not any reason to become it.
And let me remind you guys, Dr. Kinjal is a gold medalist.
I
So
became because of hard
very
work.
important.
I worked my ass off in final year. I will not deny that. I studied a lot because I wanted to do it. Because dentistry in your final year is your core 8 subjects. If you excel in those core 8 subjects, there is nothing that can stop you in becoming an excel in your future life also. Then a dentist always opens a clinic in future. No, that is also not true. There are a lot of options that we just explained earlier. There are a lot of things you can do. Opening a clinic is obviously one obvious thing that is decided. I mean, that is an obvious thing that that a dentist can do. But if not that, you can do many other things. You can go into MBA, you can go into health administration, into hospital management, into masters in public health. You can go into these fellowship courses also. You can become a professor or a teacher in a government college if you love teaching. I love teaching. I always want to be a professor. My still aim is becoming a professor after doing my internship. So I am going to consult Dr. Nishita again. So I actually love teaching. So my plan in future is that I want to do my MDS and I then want to become a professor so that I can actually guide various other students also and help them, understanding dentistry in a much better way. So it's not that you need to open a clinic in future.
So
It's
if
not
you
compulsory.
are a specialist in particular area, you can always work as a consultant at various clinics and hospitals.
Yes.
So there's no
Yes.
need of opening a clinic. You can always work as a consultant.
And
Dr.
obviously, an MDS or a master's, a postgraduate has 10 times more knowledge than on that particular field than a BDS has. So if a case comes to a dentist or to a BDS and a graduate student, obviously, if that is a case which is a little bit more advanced, they will have to call in a consultant. They cannot, they won't have that ability to treat it entirely by themselves. Obviously, they will have ability to diagnose it and they'll have to call in a consultant. So if you do your post-graduation, as doctor said, you can easily do consultancy.
So it is very much important in today's era to do a post-graduation in whichever field you are in.
Right.
To upgrade your skill set and to have a more in-depth knowledge about what you're doing.
Yes.
And Dr. Nishita, would you like to elaborate a little more on what is it like being a professor in the dental university?
So since actually both my parents are into academics and I love teaching. So now I am on the other side of the table. So now I get to know how we as a student used to feel कि क्या ये बार-बार professor, he's shouting every time he shouts, every time he says this is not correct, he rejects my work and all that. So when I'm on this side, I actually understand why they say like that. So it's fun in a very different way. But yeah, it's good. It's a very different experience for me.
Also, there is one common myth that is regarding dentistry is that people feel that इतना सारा saturation is country में that being another dentist is you will be unemployed, you won't earn as much money. But that is also not true, because when I have seen that if you have the skill set, if you are present even in a gali ka kona, there is a clinic, but you have that skill and you have that kind of aura to talk to people, because dentistry is more of building relationship with the people. You have to have talking skills, you have to have an ability to
Convince
make
patients.
up, yeah, to cause the patient कि patient अपने हिसाब से बोले, खुल के बोले कि मुझे क्या दर्द है, क्या problem है, and everything about that. So if you have that skill wherever you are, you will be able to run your clinic amazingly. So it is not that कि saturation बहुत है, सब जगह saturation है. It's not like कि engineers में saturation नहीं है. Saturation हर जगह. It depends on how your skills are of what you want to do in your career. That is the most important thing.
Any questions? So let's move on. Okay.
So this is a small video of few of my cases.
Yeah, I'll start. Okay.
Yeah.
1 second. Yeah. Is it visible?
No.
So in my cases, you will understand all three criteria of being a dentist. So doctor, engineer, and artist. So this is a case where you can see spacing between the teeth and how we covered her. You can see the difference between a smile.
Can
This
you
is-
turn it into full screen?
Yeah, I'm doing.
So this is known as smile designing, which we did for her. She was not very confident with her smile. So you can see how good change is observed in the upcoming slide. This is known as veneers, what we've given it to her. Veneers and zirconia crown. So this was a smile before the treatment, and this is after the treatment.
Wow, what a change.
Yes. And this is something known as implants, which I was talking about, for replacing the missing teeth. So here your engineering works, you should know about titanium materials and everything, what it is made up of.
The exact depth, how much it has to be inserted in the bone, the amount of distance to implant you need to keep between those. All of that is
The torque which is applied there and everything related to it. So this is a perio case. So if you can really appreciate on the left side how her gums are swollen and they are red in color. And on the right side, you can see after the treatment how the gums have returned back to its healthy color. This is a non-surgical treatment which we had done for her. This is all perio related, my field related. This is again, there's something known as, if you can see in the left side, the gums are black in color.
pigmentation.
So when a patient smiles, the patient does not want that black color to be seen. That is known as pigmentation. So we did a procedure which is known as depigmentation, which the result you can see it on the right side, where we just scrape off that pigmentation with various methods. So you can see that the patient has the coral pink, healthy pink color. There's one question: why is pigmentation caused? Pigmentation is caused because of something known as melanin. When there is excessive melanin in your body, it gets accumulated in your gingival area or the gum area, and that's why it gives you the brownish or the blackish pigmentation. This is one thing. Related, there are systemic diseases which can also cause pigmentations. There are certain medications or the vitamin medications which you eat can also lead to pigmentation. Also, lead poisoning. If a particular patient has lead poisoning, then you can see a typical kind of pigmentations in your gums. This is now scaling. This is known as scaling and root planing. These are the braces, and we have I have grafted that area, if you can see. Yeah, to increase the thickness of the gum. And this is the college where this is Bharati Vidyapeeth, Pune, where I teach, where I am as an assistant professor there. It has a very beautiful campus. The college is really very good, with fully equipped and a good patient flow. This is my department. These are some devices. This is an ultrasonic unit which is available, which you will use if you go into dentistry, opt for dentistry. This is a physio unit, where with the help of this machine you do implants. There are laser devices also available. This is our surgical area. So this is, I do consultations in Pune. So I'm a visiting doctor or a consultant at various clinics in Pune. So this is one of the clinics in Pune where I work. That's the place where I work. And this clinic also has an intraoral scanner. So nowadays, if you have heard, a digital scan of your teeth. So instead of taking impressions and all that, if you just, there's a machine kind of a thing which just scans your teeth, and it comes on your screen, and you can 3D scan this image. Yeah. So that's what is my work life and my cases.
Okay. So if you guys have any questions, you can post them on the chat box.
So there is one myth that I remembered. So it is said that when I roam around in my own society, there are so many people who come up to me and tell me that why do dentists cost so much? Why does the treatment cost so much? So, tum karte kya ho? Matlab, it is just a 5-minute work. You make a cavity. Why do you cost so much? So this myth I will tell you today, that it is not just the cost of what we are doing for 5 minutes. It is the cost of all the materials that we are using. It is the cost of the chair. It is the cost of the entire unit, the entire clinic that we are setting up. It is the cost of the radiology department that we have. We need to have those digital radiography so that we can exactly see what we are doing inside that tooth. It is the cost of the autoclave machine, the sterilization units. It is the cost of the entire innumerable amount of dental materials and the instruments that you have to use. Just for creating a cavity, you need more than 15 to 20 instruments. All of those instruments cost so much. When you use good quality instruments, it does cost more. Then it is the cost of the material that you use. The cheaper kind of materials, they break easily. You apply a bit of more masticatory force, you eat something hard, those crowns will break. But if you use a good quality material, it will stay on for a long time. It is an investment that if you do at the right time, it will help you in your long-term session. And that is why a dentist costs more, because it is not just about the 5-minute thing that we are doing, but it is about all those costs that surround us that we also need to cover for it. So a dentist does cost more, I agree, but it is if you come to the dentist at a very early stage, if there is a very little bit of cavity, your cost will also be very less. But if you come at a later stage where there is pain, your caries and your all of that germs have gone inside the depth of the tooth, we need to do a root canal treatment, we need to put a crown on it, it will cost you 10 times more. So it all depends on your awareness that when do you come to the dentist. If you do a regular checkup, it will cost what? It will cost like 300-500 rupees, I guess, for a checkup, but it will save you so much more. If you really do have a problem and you get it treated at the right time, it will save you so much more money than getting it treated after it has worsened so much. So that is one myth that I forgot earlier. I just remembered right now.
Yeah, I totally agree with Dr. Kinjal.
So we had a question. What is the scope of growth in this field? Like, what is the scope of dentistry in future?
It is bright. So see, basically, if till the time there are human beings on earth, till that time, dentistry is going, the future is going to be very bright. Because you
It's
open
like
your
food.
clinic.
If you open a restaurant, people are going to come there because people need food. Same way, till there are humans, there are teeth, there will be a dentist. And you will never fall short of work.
Yes.
So do dentists have to study like cadavers, like in the first hand, or?
Yes, yes. As
Yes,
I
yes.
explained earlier, there are dissections. We need to study cadavers. There are cadavers assigned to groups of students. We need to do their dissection. We need to learn about the various nerves, the muscles, the presence of the lymph nodes, where they are. We need to learn about the brain, the entire pituitary gland, and everything that is related to the head, neck, and face. We specialize in head, neck, and face. We do not specialize in teeth. That is the main aim that I want to tell you, that what dentistry is. It is not teeth.
Right.
So yes, we do have cadavers and we do have dissections in our first year.
Shlok says, will today's lecture be, Shlok, this meeting is recorded and it will be posted on an Instagram handle, so you can like keep in touch. And Akanksha says, as you said, that comparison must not like take place between MBBS and MBA. Is the number of hours of studying the same? Basically, what is the minimum number of hours we need to study for MBBS or BDS, and how do you go about with your studies?
So basically, I would like to say that the number of hours in MBBS, I don't know because I haven't studied that. But the number of hours in BDS, I can tell you that yes. And the most important part in MBBS university papers, you do get options for your questions. There are like 10 or 12 questions which you need to attend only 10. But in BDS universities, there are no options. Absolutely zero options. Each and every paper, each and every question is compulsory. You have to attend everything. So that means that you have to study everything because there are 10 SAQs that are given, each SAQ for 3 marks, and there are 2 LAQs, which are long answer questions, each LAQ for 10 marks. Now, if you decide to leave a topic, if you decide to leave a kind of a topic which you feel that, chalo, aaj time nahi hai, let's leave this. Let's focus on the other things. Your option mein aayega, chhod dega. That in BDS, you do not have an option because if that question then comes in the LAQ, you will be messed up because that entire 10 marks you will then lose. So in that way, when you see in BDS, you have to study each and every chapter. You have to study each and everything. You cannot leave anything like that. And as you said, for learning hours, that depends on yourself, that how much you are able to grasp in one read. Like I have seen my friends, sometimes they read a paragraph, they only kind of understand it. Then the second time they read it, they start to learn it. So it depends on how your brain works and how you are able to grasp the things. That will automatically decide how many hours you need to put into study. But still, on an average, I can tell you that each day you at least have to study for 3 to 3.5 hours. At least you study that much, you will be able to get a grasp of what has been taught to you the entire day. You can make some notes, and all of that will help you later on in your year. At the end of your year, you just refer to those things and you can get a good hold of the subject. Because in university exams, you get one paper, you get one holiday, and the next paper. So between two papers, you get one holiday. In that one holiday, you need to revise the entire subject. So to revise that entire subject, you need to have the grasp of that from the entire years, because in that one day you can't open the textbook and start reading each and every line. So according to that, you need to fix your hours. As I said, time management is the most important in any medicine field.
Yes, that's true. So in the hostel, I used to stay with MBBS people. So the studying hour is almost the same. Also, one of the most important thing what Dr. Kinjal said is that it's on you how how's your grasping power and memorizing power. And every day you should be whatever is taught on that day, you should come home and you should revise it, and you should start making notes. And plus, one more thing I would like to tell, that like how we used to study in 12th standard or 10th standard, we used to refer only one book.
Yeah.
In BDS, in medical field, it's totally different. You can't only refer to one book. You have to refer to 2, 3, 4, 5 books. Plus, you have to refer to articles. So articles written by various people, there are review articles, there are case studies, all that, compilation of all that will give you your answer. Will
And
make
that
one
is
answer.
why, yeah, and that is why, as I said, note making is very important, because you
Yeah, note
compile all
very
those
important.
things from all those 4 or 5 textbooks, you write it in one book, your own book, and before the exam, you only read that book. You do not go over to 10 different books and you open all of those pages, find out where things are. You will waste end amount of time. So note making is extremely important in medicine.
And prior to your exam, university or examination, final examination, at least 5 times revision should be done. So that on that day, like you get only 1 day holiday, like between two papers. So
Yes.
if you are if you have revised in for enough number of time, so it's very easy for you to read the entire subject in that 12 hours or 24 hours.
Yeah. Yeah. And also while in your paper, if by chance there is some things that you have left in that one day, because obviously it is not humanly possible that you will be able to read those entire 1,000 pages books in that one day. So if you have revised enough times in your question paper, if you get a question that you have not revised the day earlier, you will still be able to write it because your concept is clear. That is the most important thing. That you do not need to ratify things, you need to learn that why the treatment is like that why was the diagnosis done like that, what symptoms did you see. Those are the most important things, and then you can obviously write an answer on your own.
Right. Stuti asked us, I have heard about dentists who complete their entire treatment in one day itself, while some take a course of a week or more. Why is this difference, and how does this affect the treatment?
So all cases, they differ. So a particular case, it's like the infection is not that much. You can complete it in one sitting. Whereas another case or another tooth, it has a lot of infections which cannot be completed. The treatment cannot be completed in a day, and which it takes a week or longer than a week for the entire infection to go away. So it differs case to case. It's not necessary that every case or every tooth can be treated within a day.
Right. So if you must have learned, maybe inside the tooth there are like 3 parts. There is the enamel, which is the topmost layer, then there is the dentine, and then there is the pulp. The pulp is the layer in which you have your blood vessels and your nerves. Now when there is an abscess formation, like Dr. Nishita said, that when there is an abscess formation, there is a blob that is formed which is filled with pus. Now when you start with the root canal treatment of this kind of tooth, you can fill those canals, you can fill those pulp and those nerve material only when the abscess has completely subsided, when there is no pain, there is no complaint from the patient. Now that will only happen in multiple amount of sittings. It cannot happen in one sitting. So like those kind of cases, they will obviously need more time. But in simple cases where the infection is very less, you can do it in one sitting. So it all depends on the type of cases and the type of infection that is present in the patient.
Manya asks us, which one is easier, MBBS or BDS?
We
Both
just
are-
cleared that myth. It is not like that.
Dentistry is not easy. Dentistry is
It is
absolutely
not easy.
not at all.
It is not easy. If you consider like that MBBS में बहुत पढ़ना है, textbooks बहुत मोटी-मोटी है, BDS में कम है, ऐसा नहीं है. BDS में भी there are a lot of subjects, there is a lot of art. The difficult part in BDS is that तुमको पूरा time पढ़ाई को मिलता ही नहीं है. You have so much of practical work to do that from your 6 to 7 hours that you get after your college, your 3-4 hours will go only in completing your practical work. So basically to study you will get 2-3 hours. Usme you have to complete your entire syllabus. So it's not like that it's easier. As I already said, it is skill based. So your practical work has to be good. So it's not like that BDS is easy.
BDS includes everything. It comes your medical MBBS subject. Then you have to learn a little bit about the materials which we use. Then you have to learn about the devices which we use, the functioning of the device, the power, the RPM, the torque value, and so on. About the stainless steel wire which we use, what kind of force we are going to apply. Why do we have to apply that kind of force?
The exact amount of bend that we do to apply that kind of force.
Yes.
Everything. So it is precision based entirely.
Yes, it is precision based. So dentistry is equally difficult when you compare it with MBBS. I feel any career which you choose is difficult. You have to put in that much of hard work.
Yeah, and nothing comes to you easy. It never will. You will have to get in hard work to get your marks and to get your achievements.
Right. Manya says, also are keywords in examinations expected, or
Yes.
can we write in our own words?
Keywords are expected, like supposedly if there is a term for any kind of disorder, so basically reduced mouth opening, it is known as trismus. So your paper has to have trismus, because reduced mouth opening is a layman term. Being a dentist, being a doctor, you have to know what it is known as. So you have to write keywords and you have to underline it, because I have noticed so many of the professors that I have talked to, they tell me, they have kind of explained it to me, that when they are correcting so many papers, they do not have time to read each and every line of what you have written. So what they will do is they will only read the line or the words that you have underlined. So when you have
Yeah.
underlined something that is important, they will read those stuff, they will get an idea that you know the answer, and they will give you adequate marks. So that is very important, that you write the keyword, you write it in entire caps, or you write it nicely in bold and you underline it, so that it comes into the notice of the corrector.
So
So
the papers
in
which
my
I have
final year exam, yeah. So
the
in my
papers which
final
I
year exam,
yeah, go ahead.
you say. So I was saying that in my final year exams, in all of my papers, I did that. I wrote my answer, and in one of my paper in ortho, I did not have much time to for my LAQ question. I was so busy in writing my SAQs that my LAQ, I only had like 10 or 15 minutes remaining. So what I did is that I just jot down the most important words of that answer. So it filled my entire page. I wrote some sentences and some intro part also, but mostly I just wrote down the words, because I did not just have time. But still I got good marks and everything. So the most important key point is that you have to let the corrector know that you know it. Even if you don't have time to form entire sentences and everything, you have to know them, that you know the concept behind this thing.
Okay, so from the professor point of view, so what we expect is that it should be to the point. Don't beat around the bush. Don't write and say pura ki you ask something else and you write something else. So the most easy method is that you give an outline of what your answer consists of. You give an index like introduction, definition, and all that, and then start your answer and highlight the important parts of your answer. So that's what an examiner will look at. So this is how you should write an answer. And also, if you can, if possible, you can give references to whatever you've written. So that will give you more marks.
Right. Akanksha asks us, in a medical stream, there are many drugs, medicines, and scientific terms which are complicated. Do we need to know the art of rote learning for that?
Yes, you have to know. So there's a book called as 𝐻𝐢𝐴𝐴𝐻 and 𝐴𝐴𝐻, which every doctor or a dentist or a medical practitioner has it. So it has all, that book is only about drugs. So with the scientific name, with the composition, and with the trademark name.
What is the
So
name of
that
the
book
book?
has to be there and you should know. Huh?
Can
Pardon?
you repeat the name of the book?
𝐻𝐢𝐴𝐴𝐻 and 𝐴𝐴𝐻.
Okay.
𝐻𝐢𝐴𝐻
I
and
guess you
𝐴𝐻.
because they didn't still get it.
Oh, what? I did not get you.
I think you need to spell
Write
the
it.
name of the book so that they get
There is
it.
the
Yeah.
name of the book. Yeah, I'll write it on the chat box for you.
Yeah, better. Yeah.
Yeah.
Also, knowing pharmac is so important, because there are like contradictions to various drugs. So if the patient has already come in with corticosteroids, or the patient is on on hemostatic, and if you do an extraction, you need to know that will the bleeding stop. You need to know how your drugs, that which you are prescribing, will affect the drugs that are already on various drugs and everything. So you need to know the entire correlation, and you need to know that it does not have any side effect on the patient. So pharmacology is a very important subject that way.
Right. So the next question is, what is the method of studying? How to break our studies into subparts to excel?
What is the? I did not get the answer. Question.
Yeah, can you repeat the question?
I'm sorry. What is the method of studying? How to break our studies into subparts and to excel it?
Okay, so Dr. Nishita?
So method of study varies. So I'll tell you my method of study is I used to make a timetable. I used to allot myself that in this much time I have to complete this subject. Suppose in first year I had physiology and anatomy. So in a week, I used to divide my studying time. So anatomy, if I've studied chapter 1 and chapter 2 today, so I make sure that 2 hours may I complete everything with the notes and everything. And before sleeping, I make sure that I revise what I have studied today. And at the end of the week, I solve question papers. So basically, you should refer like last 10 years question papers and see what are the pattern of the questions which are coming, and accordingly prepare yourself.
Right.
So,
So there is a say. Sorry.
always make a timetable of what you want to do, a week timetable at least, and divide your hours after college. How much hours you have to study, how many hours you have to study, how much time you want to give yourself, how much time you want to give yourself for a break, when you want to have your dinner, at what time you want to have sleep, and before sleeping, what all you have to do. So this is how I used to divide my study time.
Correct. So it is like you just do not, you cannot have it like in day one, chalo do this subject. It is not that. You have to have your entire timetable in front of you, that you will wake up at 7 o'clock. From 7 to 9, you will complete this. You'll have your breakfast another half an hour. You need to know entirely what your schedule is so that you can be on the top of it, and you can, have spaces also in between your schedules where if you have any backlog work that is left, maybe you could not complete that chapter in 2 hours. Then the rest of the chapter, you have another backlog time for it where you can complete it. So that is, I also used to study the same way. I used to prepare my entire schedule in the morning. I would used to wake up and I write everything that I want to do in the entire day. And then before night, I ensure that I have done everything in my list. Because that is the only way you can keep on top of everything that you need to do. Because there are innumerable number of things that you will have to do. There are journals, there are the projects, there are submissions, practical work, theory work, exam preparations. So much you have to do that you have to have an idea of everything, time allotment for everything that you need to do.
So that's why time management is very, very important, because as you go into the further years, your preclinical work it becomes more. You have to do a lot of clinical.
Right. So Shloka asks us, how about the overall college life in BDS? Do they have extracurriculars? I look forward towards having a balance between the two.
Yes,
So,
we do have extracurriculars. We have cultural day, we have sports day,
annual
we
day.
have we don't have annual day, but we have cultural day, sports day, we have alumni meet. Then we have inter-university matches, like for basketball, you have football, girls football also we had, then badminton, throw ball, and so on. All the sports activities, and you could go at the university level and all that.
We also had table tennis matches, carom matches, chess. We had online Ludo matches, Clash of Clans, so many games. So you have a great balance. That is the best part. You have picnics also. Our college always for in 1 year, we always have 3 to 4 days where we interested students, we take them on a trip to some area. Like in the first year we went to Goa, in the second year we went to Rajasthan, in third year we went to Jaipur. So it depends on your college alumni how they kind of do it. But yes, in each and every college there are stuff where you can get to do your extracurricular activity also. Study.
It's well balanced.
And balanced, yeah. We also used to have those drama things where we used to enact various things.
We have that.
Yeah, so we used to enact like how patients come in and how doctors treat them, and an entire joke session we make. It's fun. We do all of those.
There was some challenge known as mannequin challenge or something like that. You remember?
Yeah,
we had competition for that also. Like which class or which branch has done it better.
We also had mehndi competition, who applies the best mehndi. We had face painting competition.
We had cake decoration, bouquet decoration, and so on. Cultural activities are fun. Cultural and sports.
One week in a year, we also celebrated this chocolate day and stuff, where there was a hidden box, and whomever you wanted to give chocolates, you wrote their name.
We have
it to whoever we wrote the name to. So it's fun.
Cultural university, the plus point which I feel that we have something known as class decoration. So they gave us a
Yes.
theme. So we got a Harry Potter theme. So we had to decorate the entire classroom into a Hogwarts theme.
Yeah.
So that's like each they give you a particular theme.
Right. It's the same thing we also had. We were given a war from the Mahabharat scene. So everybody dressed as soldiers and everything.
Yeah.
And there was a program that was going on, and we just busted into it because it's a war. So it was really fun. So
I
you
can't
do that.
wait
You
to
have
get
all
over
of
with
that.
my NEET exam.
No, you won't turn it. It's fun.
Manya asks us, could you also tell us how is scurvy treated?
Scurvy. Scurvy is basically vitamin C deficiency.
Vitamin C
Yeah.
deficiencies.
Yeah. So vitamin C supplements and you treat the particular. So normally what clinical feature you see in scurvy is that your gums become a
Bleed and
strawberry
swollen.
shaped
Yeah.
colored gums. So you treat the underlying cause. So that is scurvy cannot give you gum disease. Okay. It is not directly related, but the existing food debris or if your teeth are more prone for calculus or plaque accumulation and plus you have scurvy, then you can see that strawberry colored gingiva or the gums. So you give vitamin C supplements to that patient and you treat your gums. You do normal scaling root cleaning and if surgery is required, then you go ahead with the surgery.
Nikanksha asks us, could you explain in a nutshell about the paper publication or article we will have to write? Like what all is supposed to be mentioned in that article?
So paper publication has different categories. So there's something known as review article, there's a case report, and there's an original research. So original research is when we do a thesis or a dissertation. So suppose in MDS, it's compulsory for us to do a research on a particular topic. So for example, my research topic was I had to find out if there was any relation between cardiovascular disease and periodontitis. So then you take patients and you divide them into groups. So this is an original research which is not done by anyone. So then after my study is completed and I've come to a conclusion, I write a report on it and I publish it. The second thing is review. Review is what is compilation. It's basically you writing a answer. Suppose you want to write a review on scurvy. So scurvy, pay whatever you know. The introduction to लेके definition is pathology, it's pathogenesis, clinical features, signs, symptoms, treatment, and prevention. So all that will come in review. And case report is what in your day-to-day clinical practice, whatever cases you do, unique cases such as if you treat, say, cleft, what Dr. 𝐚𝐿 said, if you treat a cleft patient, then you can publish that. So the way of writing article or way of writing paper is very different. So it depends upon which journal. So there are various journals of various branches. So say in Perio, we have Indian Journal of Periodontology, you have Clinical Periodontal Journal. So every journals will give you a guideline of how to write a manuscript. So the thing which you are writing is known as a manuscript. So the article which you are writing is known as a manuscript. So they give you a guidelines of how your manuscript should be written, whether in which font it should be, how much spacing should be there, what should be the body, what you should include in introduction. And before writing an article, there's something known as abstract. Abstract gives you a gist of what your article will be. So abstract consists of your aims and objectives, you have materials and methods, and then you have in conclusion. So abstract will be what you want to tell from your article. So I think this is are you all getting it or is it's going bouncer?
No, we are getting it.
Because there's a lot of writing which goes into if you want to publish an article. So for a starter, for a bachelor, people who are doing BDS, you can start with review articles, or you can take small research topics or a questionnaire research topics and you can publish that. So basically you have to select a journal and then follow the guidelines. That's it.
Right. Manya asks us, around what age will the wisdom tooth turn up? Also, what is the primary function and will it be possible that the wisdom tooth never turns up?
Yeah, there is a possibility of wisdom tooth not turning up. It's a rudimentary tooth. It has no function. But
Yeah.
if it doesn't have a space, if that wisdom tooth doesn't have space in your mouth, it can give you problems. There can be swelling, there'll be very severe pain, which you'll have radiating type of pain. Yeah.
Right. Okay. And why is there such a stark difference between the fee structure of private and government colleges? Like, if there is not.
So government colleges, it's government aided. So the government gives the money to the college for functioning. Whereas private is what there's no body or no government or other third party giving money to the college, functioning of the college. So whatever fees they are taking from you, from that fees, the college is functioning. So that's why there's a fees difference. And also I feel in private colleges, some of the private colleges, they have very good equipments. They have latest technologies regarding implants, and you have 3D scanners, you have whatever latest technologies have been coming up, they have that. So that is the infrastructure cost and everything. So if you see the infrastructure, government infrastructure and private, there's a huge difference.
So I want to research more, but I do not want to study BDS. So will BDS like allow that? Like I want to research more. I don't want to serve as like a doctor. So will BDS?
Yeah. So you complete your bachelor's degree. So if you want to go into a research field, so when you like when you are in your final year, when you know about the different branches and what that branches consist of, so you can start thinking upon the topic or the field which you want to research. And then there are courses abroad, that is if you want to do public health, you can do research in public health, or you can do forensic odontology research in that also you can do. So there are different short courses abroad where you can go, or you can join some pharmacy company. You can tag along with them and they have a research a research sector in their company where you can join as a researcher there. So there are various options if you don't want to practice and if you want to go non-clinically and research oriented, or you can do a master's degree and go in and do a PhD. So that is also, you can do a research work there.
So any more questions? If you guys want to unmute yourselves, you can, to interact with the speakers. I think, okay. Yeah, I think we're done with the questions.
All right.
Yeah.
Okay, thank you so much, Dr. Nishita and Dr. Kinjal, for today's insightful session. And it was actually very elaborative throughout the session. So that is why maybe now we don't have any more questions. Yeah. The whole thing was going out throughout.
Okay, we got
and I loved the video also.
Which country abroad are good for dentistry?
Canada, UK, US, Australia.
Yeah. And in that, Canada, I prefer more, because in that you don't need to do their degree. You can only give that entrance exam and you can start preparing. Otherwise, you will have to get another 3 years doing the undergraduation only.
But just remember that Canada entrance is very difficult. Huh?
Very difficult.
You have to put in hard. It's very difficult to clear that entrance. Extremely difficult. Yeah. You can also go to Sweden and Germany. Dentistry there is also very good. But I don't know about the entrances and all that.
And do either of you look forward to opening your own clinics?
I will open a clinic once I settle down, once I get married. So after that, I'll open a clinic.
That's very sweet. And what about you, Dr. Kinjal?
I will also open a clinic after I complete my education first. There I have a long way to go. I still need to learn a lot, because this is just the basics that I've learned in undergraduation. I know that there is a lot of more knowledge out there, and I want to gain as much as I can. Yeah.
Okay, I guess there was another question in the chat box. Okay.
Yes.
You
Shloka.
video.
Yeah. Should I play the
Mhm.
video again? So, or like the recording will be shared, right?
Yeah, we'll be sharing the recording so you can like have a look then. Okay.
Sure.
Yeah.
Okay.
So all the participants, you can leave. You can start leaving now. However, I would request Dr. Nishita and Dr. Kinjal along with Sachi to stay back.
Sure.
Yeah.
Okay. Thank you so much for attending the session, guys, and I hope it was insightful.
Thank you so much for the opportunity. I always
Yes,
wanted
thank
to
you.
do this. Like after doing this entire course of dentistry, I always wanted to tell everyone that इसमें exactly होता क्या है.
Yeah. There was no one that time to tell us or guide us what to do.
Yeah, I never knew because the first time I got dentistry, I always had that misconception कि यार खाली दांत में 5 साल में क्या पढ़ूंगी. It was always that thing. But now when I underwent this entire course, I know that this is so much more. So अगर मेरे लिए किसी ने सेशन किया हो तो मैं खुशी डेंटिस्ट्री पूरा ले लेती.
Same. Yeah. Thank you for giving us this opportunity and this platform to talk about dentistry and educate the budding students,
Absolutely.
dentists. I hope to be dentist.
Absolutely.
Yeah.